Countries across Europe are introducing a new round of coronavirus restrictions. They're coming in either just before Christmas or soon after. Italy is the latest country to announce new measures. Shops, bars and restaurants there will close, and travel between different regions will be banned. Similar precautions are being taken across the continent.
A pause on public life across Europe. Shuttered shops and empty streets in Germany as the country goes into its first weekend of hard lockdown this winter. Austria will follow suit just after Christmas. Non-essential businesses will close on December 26. Austria's coronavirus infection rate is lower than many of its neighbours, but there are fears that could change. Since we are not an island and have people coming in from other countries, we should prepare ourselves for the possibility of exponential growth at any time. Sweden's infection rate, on the other hand, has been surging for 2 months. The Nordic country never imposed a full lockdown, relying instead on voluntary social distancing. But with case numbers going up, non-essential public facilities like pools and libraries will close, and for the first time the government is recommending residents wear masks on public transport. Yet the measures remain lax compared to Germany and Austria.
A very serious lockdown, for example, wouldn't have an effect in the long run because people would not put up with that.
Switzerland, too, is headed for lockdown as restaurants are set to close next week. The Swiss government has urged people to stay inside, but has left at least one decision to local authorities whether to open ski lifts. This year, skiers will have to add COVID-19 to the long list of alpine hazards.
And for more on this, I'm joined by Klaus Prümpers, a journalist in Vienna. Klaus, thanks for joining us. Austria is tightening restrictions. Can you give us the details?
First of all, we should be aware everybody who wants to enter Austria from today on has to go into quarantine for 10 days. He can test himself free after 5 days, but first of all, he has to stay in quarantine for at least 5 days, if not 10 days. Second, on 26th of December, so the second day of Christmas, everything is suspended again. All shops are closed, hotels and restaurants are closed already now, but then all shops besides food stores, pharmacies and drugstores will be closed. No museums are available up to the 17th of January. Austrians are afraid that the ICUs will be overloaded, so they close everything down again. Third lockdown in Austria.
Wow, sounds like a lot of measures are being taken. Let me ask you a multi-billion-dollar question as regards the ski industry. Switzerland, your country's neighbor, is letting local authorities decide on whether to open the ski lifts. What is Austria deciding?
It's the same. The local authorities can decide whether they open or not, and they will open, as we heard yesterday from Salzburg, and as we heard from Tirolia, for the local people in the end, because no Germans, no Italians, no Swiss people can enter. If they do so, for example, from Bavaria, when they go back, they have to go in quarantine as well for 10 days. So I suppose nobody will come to Austria to go skiing besides the Austrians themselves. But they must be aware there is no food, there is no drinks, there is no après-ski this season, and you can go only up and down. And when you go up in a gondola or a ski lift, you have to wear a mask, and not every seat may be filled.
Okay, so it's going to be strictly ski season, I suppose. Can you help us understand what the Chancellor Sebastian Kurz said when he said Austria is not an island and has people coming in? When you're describing all these complicated quarantine restrictions, it sounds like it's becoming a bit of one.
He's afraid that a lot of people living in Austria, coming from the Western Balkans, go home on Christmas up to the 6th of January, if you think of Serb Orthodox people. And he's afraid they bring back more infections as they did partly in summertime. These measures now should be imposed in a way that nobody really travels and everybody stays home. If this will function, we will see later on, but I doubt about the functionality of this, because not everywhere control is so maximized that you can exclude infections coming in again into the country. either from the south or from the north.
Of course. It's always a struggle. Klaus Pumpers in Vienna, thank you for those insights.
You're welcome.
And for more on this, I'm joined by Dr. Claudia Hansen, an epidemiologist at the Karolinska Institute in Stockholm. Thank you for joining us, Doctor. Sweden is tightening its restrictions. What are the new measures and why the big change?
Good morning from Stockholm. The big change is that the country is realizing that the present strategy does not really protect the most vulnerable and the old people. So they realize a bit that particularly the promise which was given in the spring that there wouldn't be a second wave because of reached herd immunity doesn't hold. So that is changing the public opinion, which is very important. I'm not sure whether the present measures will really bring the case numbers tremendously down after hearing. Yeah.
The government is now recommending that passengers wear masks on public transport, but won't make them mandatory. Will that work?
I don't know. They have been telling the public 2 to 6 months that masks do not work. I'm not sure how a voluntary measure now can work in public transport. It will become very difficult.
And your country, as we heard in the report, it went it alone at the beginning of the outbreak when other European countries locked down. Can we now say that that was the wrong approach?
I personally think it's a wrong approach, and it's a wrong discussion to think about lockdown and not lockdown. It is a dynamic disease. That means if you do something very short and decisive, very fast, you benefit on the long run. So it's not about sustained lockdowns. It's about very decisive, fast measures at the right time, which could help. And the public in Sweden would work on voluntary measures. It just needs to be explained why. And that has not been taken place.
So is it a failure of communication on the government's part?
The government has been saying masks do not work. The government hasn't said that there's asymptomatic transmission. That means that you can infect from somebody who doesn't know that he's ill. There is no the tracing, test and tracing and isolating is not well established. All this has not been communicated. So how can the public make informed decision? It can't. That's my opinion.
Okay, Dr. Claudia Hansen, an epidemiologist at the Karolinska Institute. Thanks for that. A second COVID-19 vaccine has been authorized for emergency use in the United States. Millions of doses of the Moderna vaccine are expected to be added to the massive American vaccination program, which began this week with healthcare workers. Older people in long-term care facilities are next in line. The approval comes 1 week after the U.S. Food and Drug Administration authorized a vaccine developed by BioNTech and Pfizer. Here's a look now at some of the latest developments in the pandemic. German health departments reported 31,300 new cases on Friday and 702 fatalities related to COVID-19. Over 25,000 people have now died of the disease in Germany. In France, the toll has passed 60,000. President Emmanuel Macron is asking people to remain vigilant after he himself tested positive for COVID-19. Australia puts parts of Sydney under lockdown to bring under control a cluster near the city's northern beaches. People may leave their homes only for work, care, exercise, or basic necessities. And India surged past 10 million coronavirus cases, the second highest in the world, although new infection rates appear to have fallen sharply in recent weeks.